Hey guys, Tony Maritato here, licensed physical therapist, and in this video I'm going to show you my favorite 3-position self-massage technique to help anybody who's had shoulder pain, maybe neck pain, maybe you had rotator cuff repair surgery, you're in physical therapy right now and you're looking for ways to loosen and relax the muscles around the rotator cuff without movement of the shoulder. So the way I do it is I take a standard tennis ball, I put it inside a pillowcase or a tube sock or anything that allows you to have control over the ball. And there's really 3 main areas that we're gonna focus on massaging. One is the area at the base of the neck. So the scalenes, the upper trap, the levator scap behind you, those are gonna be the main areas that we're gonna apply pressure. Then we're gonna work on the posterior shoulder, and we're gonna work on the space between the medial border of the scapula and the spinous process. So the rhomboid muscles and the paraspinals that run along the thoracic. So every house pretty much is gonna have a small frame like this. Then your wall, this could be a closet, this could be a bathroom. The ball tends to sit right inside that little spot really well, and it kind of positions it really well. So that what I'm gonna do is I'm gonna come into position, I'm gonna lean into the doorway and apply the pressure. The pressure, if you imagine my collarbone is right here, I don't apply any pressure on the collarbone. I go behind or above, over and back through this sensitive area. So I'll show you what it looks like. We get the ball in place, we come into position, and now I'm working up and down. I can relax. My goal here is I want to relax the arm as much as possible while I'm massaging and applying pressure through the tissue. The tendency is to get real stiff and guarded, but the goal is relaxation. You've done pendulum exercises. Think of doing your pendulum exercises while you're doing this massage. So I spend about 1 to 2 minutes working through this area. All I'm doing is trying to facilitate fluid exchange, trying to decrease the sensitivity of the musculature in that area, and retrain my nervous system to understand what a relaxed shoulder should feel like. Now in the next video, I'm going to show you how to do the posterior shoulder and the rhomboids.